Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hey everyone, and welcome back. Today's episode is for all of you expecting parents, or those of you that know expecting parents, because we are talking about prenatal care. Let's start off, as always, with our parent question.
Hi, I'm Jaden. We're expecting our first child, and from the day we got the good news about the pregnancy, all I wanted to do is protect my wife and the little one in her belly. What do we need to know about prenatal care?
That's a phenomenal question, Jaden. And even though I adopted my kids, I know as a neonatologist how important it is to provide optimal care to a fetus. Now, again, being a first-time parent, it's a magical time. It's filled with so much excitement, but we also have a lot of questions because there's a lot of unknown. So we're going to deep dive today on how to provide that optimal prenatal care. Here to discuss this topic today with us is Olivia Oppel. She is a nurse and also clinical coordinator at Boston Children's Hospital Fetal Care and Surgery Center. I am so excited to talk with Olivia today. Is it okay to call you Olivia?
You can call me Liv.
Okay, great. So nice to see you, Liv.
I'm very happy to be here. Thanks for having me.
Before we dive into prenatal care, I wanted to ask you, like I ask all my guests, what drew you into your specialty and how did you get into it?
I have always been a natural-born caregiver, so nursing was a natural fit for me. I was actually hired as a new graduate nurse here at Boston Children's Hospital, and so my training is in pediatrics. I spent many, many years caring for families in the family-centered care model. I was always drawn towards parents, and I was always drawn towards really helping them prepare for what to expect with their baby, whether it be talking about pre-op expectations, post-op care. I was really drawn to the education of the families. And so in a previous role of mine, I got to do a lot of prenatal education with some of these families on a particular subset of diagnoses. And I was really drawn to prenatal care, and that's where my love of prenatal counseling came from. So I started in the Fetal Care and Surgery Center as a staff nurse. And then as we started to ramp up our fetal surgical program and really grow the program, I stepped into a leadership position, and it's been very exciting and challenging and wonderful in so many ways. But I'm really glad to be a part of the meaningful work of bringing in utero interventions to families.
That's incredible. And I can say for our audiences listening that, I mean, truly, I've gotten to work with you in my capacity, both from a simulation perspective with the Fetal Care and Surgery Center, but also with my Neo hat. And you are definitely a very caring and compassionate leader. And so we're lucky to have you.
Thank you so much.
Let's start off and dive deep, if that's okay, into prenatal care. And you're clearly an expert. And I think many of our parents out there who may be listening, or expectant parents, may be wondering, what are the things we need to be thinking of and aware of? And in particular, what is prenatal screening and how is that important?
Prenatal screening is important because it gives the care team an idea of if the fetus is at risk for any specific conditions, whether it be a genetic condition or something that runs in a family. So these screening tests don't make the actual diagnosis, but they help us determine if we need to do some further testing.
As a neonatologist, prenatal screening is important. It helps us when we care for babies to know some of the things that might have been going on for a fetus in utero, what maybe are some risk factors. Can you talk to us a little bit in terms of a deeper dive for prenatal screening? Are they optional? And what are some of the different types of prenatal screenings that are available?
Prenatal screening is always optional. It is personalized to the family and to the care team and the discussions that the team has internally with each expectant parent. There are some families like older expectant parents or couples that have a genetic condition that runs in their family or other siblings of this fetus that have genetic conditions that are known, that these prenatal screenings are more strongly recommended, but they are always optional in a family discussion.
What are the different types of prenatal tests that are available to parents?
So a routine blood work panel is really important to get the baseline of that pregnant person's health before the pregnancy progresses. It's really important to ensure that the environment that the fetus is growing in is healthy.
That makes so much sense to me, right? I mean, as a neonatologist, a baby physician, when I look at a newborn, I'm looking at all of those routine tests to find out were there any risk factors for that baby when the baby was in utero as a fetus that might might put us at risk of certain things that we need to do to care optimally for that baby. Things such as a risk for more jaundice, or they maybe have an infection risk. And so all of these things are important for us to look at for the parent and for the baby.
Absolutely. And something that we look at too in prenatal blood work is the mom's glucose level, for example. And are we worried about a predisposition for gestational diabetes, for example? Or we look at the pregnant person's blood type as well. We don't know the fetus's blood type, so we always want to have an understanding of what the pregnant person's blood type is to be able to understand, is it going to be compatible with the fetus's blood type, for example?
Because we know there are risk factors for the parent and the baby. And so we just want to check
Absolutely.
that box and make sure.
And that's recommended for all pregnant people. Additional things that can be discussed among the care team and with the expectant parents are things like a non invasive prenatal test, for example, or an NIPT. And what that does is it looks at the chromosomes of the baby to give us a screening tool to understand if we need to look further into the genetics of that fetus and of the pregnancy to see if there are things that there are higher risk for, such as genetic conditions.
Well, and what's exciting about that test, it's really just taken from a blood draw, right, from mom. So it's
Correct.
not invasive to the fetus.
Correct. And prenatal screening has come a long way over the years. And so a quick blood draw at the time of your routine labs, anyways, can also give parents the fetal sex quite early in gestation, which is usually a crowd pleaser. Parents are very excited about learning as early as 9 or 10 weeks gestation what the fetal sex is.
Whereas previous to that, you had to
Correct.
wait until
The
your
anatomy
ultrasound.
scan.
Yep.
Yes.
So let's
Yes.
talk about ultrasounds because there's lots of different imaging, right, that we can consider
Yep.
for a fetus.
Yeah, so the ultrasound is really the most wonderful tool in pregnancy. It gives us a sense of what's going on inside the uterus. It looks at the fetal well being, it looks at all the structures of the pregnant person, it looks at the structures of the fetus. So it really is a view inside the womb for us to be able to determine what's going on. So there are various levels of ultrasounds. The first ultrasound that typically happens is a viability scan, is what we would call it. And it's as early as 7 to 9 weeks. It looks at the fetal heart rate. It makes sure that the pregnancy looks healthy. And then from there, the subsequent scan would be around 12 weeks gestation when it's called a nuchal translucency scan or an NT scan. And that's the first time they do a quick look at the anatomy, see if there are any glaring differences in the structures of the baby, and also look at the back of the neck in particular. There's something called a nuchal translucency. There's a measurement that's taken. And if there's something that falls without of a norm, we then also do a deeper dive into what's going on, if anything at all.
That's a good, very high level, non-specific screening tool to say things are looking as expected versus there may be something we need to further evaluate.
Absolutely. And then from there, really, the large scan that families anticipate and providers anticipate is anywhere from 18 to 20 weeks gestation when we call it the fetal survey or the anatomy scan. And that's really the first time the parents get to see the fingers and the toes and the chambers of the heart and the brain and the intestines and really a true head to toe and anatomy scan on that fetus. So really, if there is going to be anything that's detected, that is the most common time for an MFM who is a maternal fetal medicine doctor and the obstetric team to say, we see something abnormal in the intestines, for example. So we want to look further or we want to take further testing or further images to understand what's going on.
Even if just at that relatively routine or common 18 to 20 week
Mhm.
anatomy scan that we do today, it's even better than it was, say, 30 years ago when many things were missed, right? My understanding is now that the ultrasounds are just pretty detailed.
Yes, they are. They're quite incredible. And also, the art of sonography in the maternal fetal world has gotten so subspecialized that everyone who is scanning you at the bedside is truly an expert in that. This is what they do day in and day out. They look at anatomy of fetuses. And so anything that looks slightly out of the norm for them, there's really no hesitation to say, okay, let's look closer just to ensure and give these families all the information that they could possibly need to figure out if there's something or if it was a shadow, for example.
It's incredible. So, all of these prenatal tests that are available to parents thus far have been pretty non invasive,
Hmm.
particularly for the fetus, obviously. What are some of the potentially more invasive tests that might be recommended to patients?
It's a good question. So, as you mentioned, everything we've done so far has been non invasive. We really start to get into more invasive testing, which means doing some procedure on the expectant parent to look at the genetics or look at something specific in the fetus. So typically what would happen is at that 18 to 20 week anatomy scan, if something was seen that was detected to be abnormal, a discussion would be had with the expectant parents and the care team. Often that's when genetic counselors get involved to discuss, is there panels of genetic testing that we should be looking at based on what we're seeing look different in the fetus? Do we have a greater concern for what we would call a trisomy? Are we concerned about a specific syndrome related to how the intestines look on ultrasound, for example? So that's when you get into invasive testing. That usually involves a needle-based procedure going into the uterus to take some samples of the amniotic fluid that contain fetal cells, and then testing it, growing cells, and really looking at everything under a microscope to see, are there duplications, deletions, anything going on in the genes or in the chromosomes themselves to indicate that there might be a genetic condition.
So we can even dive deeper if need be, if there's something that suggests that would be helpful to help the whole care team and the parents based on what is identified.
Yes. And you'll hear a theme throughout prenatal conversations is really about setting expectations, gathering information as much as you can to understand the health of the fetus, the health of the expectant parent, and really be able to better predict how that baby will need care after delivery. So the theme is truly pre education, helping families understand what to expect.
That's great. That's great. So, are there any other tests that parents might be aware of or need to know about?
There are a lot of tests that we can do throughout various phases of pregnancy. And we'll talk more about really comprehensive fetal care when we get into what a fetal care center is all about. But I do just want to highlight that the theme of prenatal counseling and what you'll hear throughout all of this conversation is we really provide anticipatory guidance. The goal of doing the deep dive into the genetics and doing the prenatal screenings is to really understand what's going on with the pregnancy, to give families information, to be able to better understand what their child will be like and what the care teams might need to consider when taking care of the baby after delivery.
There are so many patients that I've cared for where maybe because of limited access to prenatal diagnosis and screening, things weren't known. And then it's a surprise for parents, it's a surprise for the medical team, the care team. And so, obviously, being prepared and being able to anticipate and be ahead of the game is always a good thing for anybody. So, that's why this is so important.
And that's why fetal centers exist.
I can't wait to dive into fetal centers and our program. But before we get there, I'm imagining many of our listeners, expectant parents, they're thinking, okay, this is a lot of tests. What are the things that parents should be considering when they're trying to make decisions about these tests?
It's a great question. The largest thing that I would say is to partner with the care team. They really have your best interest and the pregnancy's best interest in mind. They want to help provide information to the families just as much as they want information for how to manage the pregnancy. So I think really a discussion with the care team about what their recommendations are, and then asking questions about what are the risks of doing an invasive procedure, or what if we get a result that we're very concerned about, what are we going to do with that information? Those are things that families will discuss on their own as well as with their care team.
That's really great. As a children's hospital, we don't really deliver babies here. So, can you tell me more about the types of patients that we care for here and why this is such an important topic?
So you're right. We mostly do not deliver babies at Boston Children's Hospital. We do have select families that we consider doing a cesarean section birth in Boston Children's when that baby needs immediate access to neonatal care. These are highly coordinated, high risk deliveries with many care teams involved in the decision making of considering the pregnant person's health and well being in the discussion, as well as what that infant needs immediately after delivery.
Well, thank you for clearing that up because I think that's so important. I mean, the good news is that when the fetus, we know after birth as a baby is going to need immediate care, we can provide that care. But in other situations, we can still partner right with other hospitals and have the pregnant person deliver in a maternity adult focus area. Is that correct?
That is correct. And we have wonderful partnerships with obstetric hospitals across the city in Boston. And then we know that we provide the world class neonatal care afterwards. So, whatever that transport might look like of the baby over to Boston Children's, it's a well oiled machine across the Boston area.
So it's important to give good care both to the pregnant person and the soon to be baby.
Absolutely.
And we got to work together to do that.
Yes.
Love that. Love teamwork. Anything that brings up teamwork makes me happy. So, with all of those prenatal screening results that are coming to expected parents, if something is found that requires further evaluations, what's next for parents?
So, what's next is a discussion with the care team about what diagnostic testing or what procedure might need to be done to be able to determine what a diagnosis might be, if any, for this fetus and this pregnancy. And then, additionally, a referral usually to a maternal fetal medicine doctor or a fetal care center would then occur.
So, thinking about that now, specialized care,
Yeah.
first for our audience, what is a maternal fetal medicine specialist?
Yes. So, a maternal fetal medicine doctor or an MFM is an obstetrician who is trained in delivering babies in the care of pregnancy, but has additional training in high risk obstetrics. So, both on the pregnant person's side as well as on the fetal side, there's extra training there.
They're clearly a specialist to seek out, and most OBs, obstetricians, would then refer you to one.
Yes.
So, knowing how important MFMs are to the care of a fetus and expectant parents where something has been identified that might be higher risk, does our fetal care and surgery center have MFMs?
We do. We have maternal fetal medicine doctors as well as MFMs who have additional training in fetal intervention, fetal therapy, and fetal surgery. However, part of our program's mission is to really partner with local MFMs and obstetricians because we understand that coming into Boston for majority of your care can be burdensome on families. So we do like to partner with local obstetricians and MFMs to continue routine care closer to home and then really come to Boston for subspecialized care.
When I started out as a new pediatric physician and then neonatologist, we had obstetricians and we had maternal fetal medicine specialists, but now we even have maternal fetal medicine doctors that are even more subspecialized to provide fetal interventions and care. So, can you tell me more about that higher level?
So, in a fetal care and surgery center, for example, like ours at Boston Children's, there's really kind of two categories of patients. There is something that's going on with the fetus itself. So, whether we see a difference in the intestines or the heart, for example, we have teams in place to partner with the families on really educating those families about what that condition might look like, what that difference might look like in utero throughout the rest of the pregnancy and also after birth. We provide advanced imaging such as high definition ultrasound, MRI, as well as fetal echocardiogram. And all of these advanced testing and advanced imaging together can help diagnose something going on with the fetus. And of course, as it pertains to all the advanced imaging that we can do, we have expert fetal radiologists as well as our sonographers who really can go in depth during the scans, looking head to toe at the babies, and then developing incredible protocols for reading MRIs and ultrasounds to really get the best sense possible of what's going on. And we have subspecialists from across the hospital who are experts in their various pediatric fields who come to the fetal center and meet with the families in a multidisciplinary style team meeting to teach these families about, does this baby maybe need a NICU stay after delivery? Does the baby anticipate needing surgery after delivery? And really painting the road for what life might look like with that child, both immediately after delivery and then long term and lifelong.
So important, right? Because now you're talking about providing this comprehensive care team and a comprehensive care environment to ensure that both parents and fetus get the best care possible.
Absolutely.
So, you talked a lot about why it's important to go to a fetal care and surgery center for reasons after the baby's born. But is there anything that's important for caring for a fetus before they're born?
Yes, and that's actually where those subspecialists of fetal surgeons and fetal interventionalists come in. There are some pediatric conditions that can actually be treated in utero, spina bifida being one of those. There is a surgery that a fetal surgeon can perform in utero on the baby to close the spina bifida during the pregnancy and then let the pregnancy continue to gestate closer to term. And that is something that we evaluate again in a multidisciplinary way to see if this family is a candidate for this procedure. But it is something that when we look at pediatric diagnoses or diagnoses that can be treated in utero, there are options that exist. That's something that we're always assessing as well.
I know about that because we got to work together to help with some simulation to prepare our teams for care of pregnant persons with a fetus who has spina bifida, also known as a neural tube defect. And we were able to rehearse and make sure we were ready for those surgeries. What we're seeing now is that in utero intervention for many of those in that that population actually have some improved outcomes. So this is so exciting to see how the ranges of therapies we have available are just really growing and pretty innovative.
Absolutely, yes.
So I want to mention, I heard you say a second category for why parents might want to consider a fetal care and surgery center. So can you share a little bit more about that?
Yeah, so we talked about the first category of differences with the fetus. And the second category would be differences or concerns about the environment that the fetus or the fetuses, if there's multiple, are growing in. And these might be related to a placenta. These might be related to a complicated twin pregnancy, for example, where a complicated twin pregnancy might share a placenta. So there does run the risk of unequal distribution of blood flow to one baby or another who are sharing tight quarters inside a womb together. So we do look at the environment in which fetuses are growing in to make sure that it's safe for them to continue as long as they possibly can to get to term. So there are conditions, something called twin-twin transfusion that we see a lot of, that we are assessing to see if there's anything that needs to be done in utero to help both of those fetuses thrive throughout the pregnancy.
So important because those are
Yes.
some of the most high risk babies that we care for after birth when there has been twin to twin transfusion and one baby or both babies have different complications because of that. So it can be very high risk. So the fact that we can now look at and potentially intervene and prevent some of those downstream effects of that twin to twin transfusion in utero really just helps us to have healthier babies born.
Absolutely. And what I'll highlight about a comprehensive fetal care center too is that advanced imaging help us understand what's going on with the fetuses and then really bringing the people to the table who know the most about the condition and the disease process, who can insert their expertise there and meet with the families and really say, these are all the options, whether they're in utero, whether they're around the time of delivery, or whether they're more long-term and comprehensive for these families to enter the pediatric system and build this long-term relationship with Boston Children's Hospital in general.
So great. A fetal care center does a lot of different things, providing very high intensive care for families. I imagine that it takes a pretty big team to do that. And one of my things that I love to talk about are the fact that so many of the programs that support our patients and families are multidisciplinary because healthcare is a team sport. So I was wondering if you could talk to me a little bit about the multidisciplinary nature of our fetal care center and surgery center.
Absolutely. That is my pleasure to talk about the wonderful team that surrounds all of these patient interactions. The wonderful thing about a comprehensive fetal care center is the care team that is involved. Every patient that enters the door of Boston Children's Hospital in the fetal care and surgery center has a primary nurse that's assigned to them. And that primary nurse or nurse practitioner really acts as a liaison between the family and the care team. We have subspecialists, as I mentioned, from across the hospital. So, cardiologists, general surgeons, neurologists, neonatologists, maternal fetal medicine specialists, and all of those care teams come together to provide the best care for not only the expecting parents, but also what that baby would need after delivery. So, the nursing team is the heart of the care team, and we work very comprehensively with our social work team, who provides extensive psychosocial assessments on our families to make sure that they're in a really good headspace around caring for these babies, as well as our genetic counseling team, who really educates the families on what all of these different genetic testing might look like and what their options are. So it really is a team effort, as you mentioned, and a team sport to come together to care for these families. And what I can say is that these families really feel held through the process. So they are never left alone to navigate the system. There's always a person that they can reach out to from the care team to help explain the processes or explain what their day of appointments might look like, for example.
That is so important and so valuable. And I love what you said. You hold their hand, you support them through the entire prenatal process. What about birth and care after that? How does the team support and make a plan for that?
We know that as soon as you can diagnose and help educate these families about a prenatal diagnosis that will lead into childhood or lead into infancy, the better those outcomes can be for the families and for the baby. Being armed with information about how to take care of the baby is an ultimate goal. So, going into a delivery, for example, we do lots of assistance around high risk coordinated deliveries. If a family lives outside of the New England area, but we know really needs care at Boston Children's for their baby after delivery, we partner with our obstetric hospitals for providing prenatal care more locally in Boston for those families to be able to deliver close by so their baby has access to Boston Children's shortly after delivery. So there's a lot of hands-on care that goes into the coordination of high-risk deliveries from the prenatal side so that the families can truly show up, deliver the baby, and really have an expectation set about what is going to happen after delivery.
And then once delivery happens, whether that be at a partnering hospital or at our hospital in certain rare situations, then some babies might have already had a fetal intervention and maybe they go home pretty quickly or average what other babies might, or maybe they might need a neonatal intensive care stay and further subspecialty care. So, how are those conversations supported with families?
Those are our multidisciplinary team meetings with the families and our neonatology team, for example, and our MFM and our general surgeon or whatever might be tailored for that family's needs based on what that fetus needs in utero, based on what the expecting parents need in the pregnancy phase, and then also what we're anticipating the infant to need after delivery. So team meetings happen. The families are really prepared with full breadth of expectations about the neonatal care as well as more of the long-term care. And something that we really are honest with families about is what that NICU stay might look like, how long they might be in the NICU, how much of it is intensive care versus how much of it is care that the babies are learning to feed and grow on a surgical unit but aren't quite ready for home yet. And then additionally, what the transition to home might look like as well. Will there be feeding support at home, VNA, nursing care at home, all of those types of things. So on the front end and before that baby is even born, these families have at least a roadmap of what things might look like after delivery.
Not only comprehensive care, but you're looking at the whole continuum of care till baby gets to go home and even beyond. So, Liv, obviously, this topic is so important to the two of us, but I think it's just so exciting to hear how this field is growing and just how much is coming on the horizon. When I first started hearing about fetal surgery in and of itself, I had a colleague who was a surgeon who said, that's just crazy nonsense. No one's ever going to be operating on a fetus before they're born, right? And look at it today. So I wanted to hear from you, who's right there in the thick of it. What are the new innovations going on? And in particular at our fetal care and surgery center.
So, as you mentioned, the field is incredibly full of innovation and a lot of very smart minds that are coming together to really advance the field of fetal surgery and fetal medicine in general. There are many active clinical trials that are going on, many active research studies nationwide. What I think is wonderful about this field in general is we tend to pool our information together. So, there are consortiums across New England, North America, who are saying, okay, you give us your information, we'll give you our information, and we'll pool all that information together to find the best outcomes and what we're going to do moving forward. So it's a very collaborative field.
Super exciting. Who knows what we'll be talking about 5 years from now. So we've talked a lot today about a lot of different things related to prenatal care, prenatal screening, fetal care, fetal surgery. Is there anything that we haven't yet talked about that you want to make sure our audience hears?
Yeah, I would like to just plug here that the most important thing for families to take away from this is that the true heart of a fetal care and surgery center is to provide the best possible outcomes for the family that we're caring for, as well as their baby after delivery or babies after delivery. And that family centered care really starts even before the baby is physically here in front of you.
That's great. That's great. And sometimes the outcomes are not as ideal as maybe we all want, but we are still there to help support and make it as optimal as we can for each individual family.
Absolutely.
So now into doctor's orders. So this is the part of our conversation where we prescribe an action that parents, families can take today to help raise healthy kids. So what are your doctor's orders, Liv?
Well, my nurse's orders are to dive in. Dive into everything that's going on in your pregnancy. Dive into your changing body. Dive into the information that's provided to you about your pregnancy as a whole, your fetus, and what to expect after your baby is born and when your baby is there with you. Dive in. Gather all the information you possibly can. Know that there is a care team that's with you walking every step of that journey, whatever that journey might look like and whatever the outcomes might be. You will never regret learning everything you possibly can about yourself in this changing time and your changing family.
It's so important. Information is powerful.
And it grounds you. It gives you a sense of control in an otherwise uncontrollable situation. We want families to feel powerful through their journey with us.
That's so great. Thank you, Liv. It's been such a fun conversation.
Thank you. It's been my pleasure. It's been fun to talk about fetal care.
Thanks so much for listening to Boston Children's Answers Parentcast. And special thanks to our guest expert, Olivia Oppel, and our guest parent, Jaden. To learn more about this topic or hear any of our other episodes, check us out at bostonchildrens.org. Thanks so much and see you next month.